the concept of universal coverage and single payer, those two concepts often get conflated, but I think they're very distinct and different. So take, for example, Massachusetts, right? Massachusetts has pretty darn close to universal coverage. They have a 2.8% uninsured rate. That's like as good as it gets, I think, really. But they don't have single payer. In fact, they were the model for Obamacare or the Affordable Care Act, right? So it's certainly possible to get to universal coverage by building on the ACA. And I think that's the kind of argument you're seeing from Pelosi and others. And I think something the Biden administration campaigned on. There are, of course, still gaps. You have these Medicaid, these states that will not, maybe even with big financial carrots, ever expand Medicaid. And then you have folks that the ACA just sort of shut out. For example, people who are undocumented immigrants. But I think it is possible to get to universal coverage using the ACA framework. Where a public option, I think, could really be useful is, for example, in those parts of the country where there's just not affordable coverage options, either in the marketplace or because a state hasn't expanded Medicaid, or just in general to keep overall costs down. But I have to say, even if you could get a public option done through reconciliation, which is a big fat if, I don't know that there's 50 votes for that